Ladies and gentlemen, hello and welcome to the beginning of a brighter future. If that statement was too bold, let me explain. Do you ever wish there was something you could do to look after your parents? Have you ever worried if your grandparents were forgetting to take their meds? I want you all to take a second and imagine living in a reality where you knew your loved ones were in good hands at all times. Here at Alzmite Medical, we understand that family is everything. That's why Jordan Mueller, Ryan Lalchan, Jason Cow, Marcus Lechner, and myself, Tony Habib, are here on behalf of the company to show you the hard work we've been doing to protect those near and dear to your hearts. Although our target audience is broad, we particularly sympathize with those who can no longer look after themselves. This is why our innovation was designed to be especially effective for people who suffer with dementia. So let's make sure we're all on the same page. What is dementia? Dementia is a term used to describe a general decline in memory and cognitive abilities to an extent that interferes with daily life and prevents individuals from being self-sustaining. Alzheimer's disease is the most common cause of dementia and accounts for over 70% of all the cases. It is a degenerative brain disease which progressively worsens over time in the form of permanent cellular damage. Did you know that 1 in 10 people ages 65 and older have Alzheimer's? If that statistic doesn't scare you, then imagine that year by year, the point of a third of the population ages 85 and older suffer from Alzheimer's. It's quite a lot. So what's the problem we're addressing? Well, despite the healthcare industry's valued efforts in developing treatment to minimize the effects of dementia for patients with Alzheimer's disease, a concerning issue sadly persists. The availability of remedies do not diminish the elevated risks of patients overdosing or underusing prescription medication due to their memory loss. Research still holds memory as the main reason that 55% of adults are not adhering to their medicinal requirements. Therefore, our mission is to design a device to be used by Alzheimer's patients to prevent improper consumption of prescription medication that is cost-effective, reliable, and easy to use. If you or someone you know is victimized in some way by any of what was mentioned, then keep listening, because we're going to showcase the device that will change your life.
The main scope of this project involved developing a point-of-care biomedical pill dispensing device for Alzheimer patients. Main features of this include automatic capsule dispensing during prescribed consumption times, a method of reminding users to take medication once dispensed, prevention of over and underdosing, reduction of medicinal misplacement, compliance with Canadian safety, environmental, and health code standards and norms, and a size and shape that is aesthetically pleasing. It is important to note that out-of-scope features of this design include ingestion and device maintenance. These two things are ultimately the responsibility of the patient, caregiver, or family member.
The design solution must follow these constraints. ISO 1345 must be followed as it is a quality management system for medical devices. The design solution must have all UL listed components and be outlet powered to ensure credibility and safety. The design solution must be easy to use, as the target audience are those with Alzheimer's who struggle with memory loss. The design solution must accurately dispense at the correct time and the correct dosage. The design solution must hold 1 month's worth of medication. The image on the screen is a medication storage container that holds 7 days worth of medication. The design solution must hold 1 month's worth of medication and must have the volume capacity to do so. Finally, the design solution must notify the patient when it is time to take their medication. This also must be designed for those with hearing impairment, as the elderly often have hearing impairment. The following criteria should be followed in the design solution. The design solution should maximize energy efficiency. It should do this by being ENERGY STAR certified. ENERGY STAR certified means it also has a minimized environmental impact. The design solution should minimize weight. This is so that it would be in the safe carrying capacity for elderly, which is less than 6 kilograms. The design solution should minimize costs. This is to ensure it is accessible to all. The design solution should minimize the help required. This means it should minimize the amount of time a caregiver or personal service worker takes organizing medication and administering the medication to the elderly and those with Alzheimer's. The design solution should minimize size. Often these medication devices are stored in convenient and common spaces, and we don't want it to be too big to distract the eye and cause a disturbance. Finally, the design solution should maximize communication. This means that it should alert caregivers when medication is not taken or the medication is low and needs to be replaced.
Our team truly believes that in order to achieve an exceptional solution, a serious and meticulous design approach needs to be put in place. Therefore, we've broken down our approach to two parts: the design process and the tools used. Let's start with the design process. More specifically, we use the Scrum framework to create sprints for each deliverable. Sprints kept us organized by addressing all deliverable requirements. We would also visualize our progress with burn down charts that plotted our tasks completed and tasks in progress. We would also have short daily meetings to keep all members in the loop and to discuss any blocking points. Teams was our central hub for communication, and it also had other purposes. We used it for file sharing, creating deliverable checklists, and for general project planning purposes. These are the things that account for our design process. Now, let's move on to tools used to support our design. SOLIDWORKS was used to model our device. We rendered a 3D model of our design for prototyping and to generate calculations. Two important calculations we were able to get from SOLIDWORKS were the size and weight of our design. The size and weight are important because they directly relate to the design criteria we have selected. Google Drawings is a diagramming software that we use throughout our design process. From the beginning, we used Google Drawings for mind maps to help us identify the problem. Once that was done, we used Google Drawings to create a Gantt chart to help us establish a project timeline. Afterwards, we used Google Drawings to create a flowchart of our software logic and circuit diagrams.
The design that our team came up with was an automatic pill dispenser that focuses on simplicity and ease of use. We achieved this by resembling our design off of a familiar alarm clock. This is seen by the large digital screen here that shows the time and simple instructions, and the large red button here that has sleep and snooze controls. The reason why our team focused on a simple design is because it promotes equity, diversity, and inclusion. We have to take in consideration that people who might be buying this device might not be so familiar with a complex system such as a phone or a TV because they aren't able to afford it. Also, by keeping the system simple, we can reduce cost on components and parts, and there we can make sure that patients with lower incomes are able to afford this device and get the help that they need. When it is time for the patient to take their medication, an alarm will sound and the LED light on the front will flash to remind them that the medication is ready to be taken. It will then fall down to the chute here where the patient can easily pick it up. To snooze the alarm, the patient will press the large red button on top of the device. If the medication isn't taken from the scoop within 5 minutes, the alarm will sound again and the patient will once again have to snooze the alarm. This cycle will repeat until the device detects no more medication in the scoop. Let's open up this device and look inside to see how it works. Right away you can see the circular cartridge with 62 slots. That's for 30 days and 2 doses a day. I removed the top layer here so we can look inside and see how this cartridge works. The great feature about this cartridge is that it's removable. This allows a patient to take this cartridge out when it's empty and bring it to a pharmacy where pharmacists can organize the medication and fill it out so that the patient doesn't have to worry about misplacing medication or not giving themselves the proper dosage. Inside, we can see a stepper motor that drives the shaft that's press fitted onto it. The reason why I went with a stepper motor is because of its high torque and the ability to evenly and precisely tune in the correct degree that we want the stepper motor to turn to. It also has a housing here that has all the components such as a microcontroller, step-down converter, and battery bank. Here is a small limit switch that acts as a presence sensor to ensure that the cartridge is installed. Let's take a look and see how this device dispenses medication. The stepper motor drives and rotates this circular cartridge. The slots in this cartridge are cut to half the size and have a chamfer so that medication gets funneled down into the hole of the compartment. As you can see here, as it rotates, only one compartment is open at a time. Then the second compartment opens, and so on and so forth. After the medication falls out of the compartment, it comes into the chute here, which has an angle of 20 degrees, which is more than twice the angle needed to ensure that no medication gets stuck on its way down to the scoop. Now the scoop here has a radius to ensure that someone with minimal dexterity is able to reach their hand in and pull out the medication. Also, we have an LED light here to shine light into the scoop so that someone who might be having difficulty seeing can see the medication and ensure all of it's taken. The design of the scoop and the use of an LED light simply reflects our team's dedication to equity, diversity, and inclusion to those who might have disabilities. The medication inside the scoop pushes it down, and in turn, it rotates on this axis, pushing up onto this load cell. This allows the automatic pill dispenser to detect if medication is still there and if the patient needs to be reminded again to check the scoop and take whatever medication is left over.
To ensure that this device is safe, it will be ISO 1345 compliant. ISO 1345 is a quality management system directed towards medical devices. This quality management system will be followed for all stages of the product lifecycle. It also provides organizations with a medical device that meets both customer and regulatory requirements. The next step to ensure safety is UL certification. UL is a certified body that helps manufacturers with compliance with all applicable standards. When a device is UL listed, it means that all electrical components meet both Canadian and national electrical code. In Canada, in order to obtain a medical device license, the device must be classified based on its risk with a class. Class 1 being lowest risk and Class 4 being highest risk. This medication administration device will be Class 1, and this was based on the flowchart pictured on the screen for non-invasive medical devices. As you can see, this device falls under Rule 7, all others, and Class 1 is circled in red.
The main social and lifestyle benefits of this design include medicinal adherence and reduced load on personal service workers. To explain, data from the Alzheimer's Association of Canada showed that over 42% or 21 million Alzheimer patients reported at least one time improperly ingesting medication per year. This was further amplified by the fact that 64% of all Ontario long-term care patients have been diagnosed with dementia. This shows the prevalence of the problem, especially here in the GTA, where many of these long-term care homes are located. Furthermore, it was shown that Alzheimer personal care service workers spend up to 7 to 10 hours a week organizing medication. This amounts to $250 per week for families of these patients. This device can hope to mitigate these costs and the load for family members and the personal service care workers respectively. Overall, this would allow these members and the workers to spend more time caring for the patients. The environmental benefits of this design include decreasing the overall pharmaceutical waste outputted by patients and, from a long-term perspective, reducing the construction of long-term care homes. Furthermore, this device was made using PLA plastics. This plastic, known as polylactic acid, is very biodegradable, especially when compared to the alternatives. These factors can combine to reduce the carbon footprint of the design and ensure that from cradle to grave, its environmental impact is as minimal as possible.
I'm sure our design sounds too good to be true and that you might have some concerns. We've listened and applied feedback regarding some of our most common concerns. The first concern is, what would happen if there was a power outage? This is not a problem for our design because we provide a backup battery in case of emergencies. Next, another concern is that our device only supports medicine in the form of capsules. We chose this because Alzheimer's medication is currently only available in capsules. Moving forward though, we will consider expanding to other forms of administration to accommodate new medications. The last common concern is that, what if the patient refuses to take their medication? Well, our device includes Wi-Fi, so caregivers and loved ones have the optional feature to check if the medication has been taken.
On behalf of the Alzmite family, thank you for watching. If you have any questions, comments, or concerns, please feel free to connect with us. We'd love to stay in touch. Your support means the world to us, and we're dedicated to return the favor by looking after your loved ones. Thank you.